Every year, we honor the men and women who died while serving in the U.S. military. While many lost their lives in combat, others died from battle wounds you can't always see, suicide, and the mental health struggles caused by post-traumatic stress disorder, or PTSD. But there is hope for the many veterans who are living with PTSD. We're here to shed some light on the resources and recovery options available that can help save lives.
This program is made possible by Lois Pope. We salute her generous philanthropy and unwavering support of our veterans.
Welcome, everyone, to Healing America's Heroes. I'm Olga Villaverde. Thank you so much for joining us today. So how many veterans are experiencing PTSD? Let's show you some numbers. According to the U.S. Department of Veteran Affairs National Center for PTSD, during Operation Iraqi Freedom from 2003 to 2011 and Enduring Freedom in Afghanistan from 2001 to 2014, between 11 and 20% who served have PTSD in a given year. Desert Storm in 1991 was shorter in comparison, 42 days long, and yet 12 out of every 100 Gulf War veterans have PTSD. And it's estimated that about 30 out of every 100 Vietnam veterans have had PTSD in their lifetime. There is no question at all, that more needs to be done to help veterans, and our panel of experts agree. I'd like to introduce each and every one of them. We start first with Cherissa Jackson. She served 23 years of active military duty service. She spent many years as a nurse treating the injured. She retired from the military and now serves as Chief Medical Executive for AMVETS, an organization working to help veterans nationwide. Dr. Sonya Norman is the director of the National PTSD Consultation Program, a service of the U.S. Department of Veteran Affairs, and a professor of psychiatry at the University of California, San Diego. Dr. Robert Pietrzak is the director of the Psychiatric Epidemiology Lab at the Department of Veteran Affairs National Center for PTSD. He is also a professor of psychiatry at the Yale University School of Medicine. And Montel Williams, a tireless advocate for veterans and a graduate of the U.S. Naval Academy. He's a Navy and Marine Corps veteran serving in the military for 22 years. Montel is also a TV host and an MS warrior. I welcome all of you, and I thank you so much for joining us this evening.
Thank you. Thank you.
I do want to remind our viewers that this is a virtual town hall. It's coming to you live. So if you have a question for our experts, please let us know. And it's very easy to get in touch with us. Just send us your questions to questions@allhealthtv.com, or you could put your comments in the Facebook comment section below and YouTube as well. All right, ladies and gentlemen, let's get started. Let's get started first with just the term PTSD. We hear it a lot. What exactly is it, and does it ever go away? Dr. Norman, let me start with you.
Sure. So PTSD stands for post-traumatic stress disorder. It can happen to some people after they experience a life-threatening traumatic event. So certainly combat and wartime experiences count for that. Lots of civilian experiences can be traumatic too, car accidents, assaults. Most people have a hard time right after something like that happens and recover over time. But some people go on to develop PTSD where they continue to have symptoms where they can't stop thinking about it. They might have nightmares, but at the same time, they're putting a lot of energy into trying not to think about it, not to remember, not to do things that remind them of it, which can be very exhausting and really limit someone's life. And they also might find that the way they see the world has changed. It might feel more dangerous. They might not feel as competent in the world. People startle more easily. They have more concentration and sleep problems. So those are some of the symptoms. In terms of your question about does it stay with you forever? No, it's not a life sentence. We do have really effective treatments. And I know we'll get to that in today's show.
And we will. Dr. Pietrzak, your thoughts?
Sure. The only thing I would add, in addition to what Dr. Norman mentioned, is that there's an emerging emphasis on conceptualizing post-traumatic stress symptomatology really on a dimensional continuum, which is turned out to be quite useful for us. And with this conceptualization, it really encompasses the full spectrum of no symptoms to mild to moderate and severe symptoms. And this has been quite useful for both clinical and research purposes, as post-traumatic stress symptoms may be a precursor or risk factor for developing PTSD. My research group recently found that veterans with what's called sub-threshold PTSD symptoms, so below the threshold that's required for a diagnosis of PTSD, were more than 6 times more likely than those without such symptoms to develop PTSD over a 7-year follow-up. And the idea here is that post-traumatic stress in general, not necessarily where it's so severe that it's a disorder, may actually sensitize an individual to subsequent stressors and trauma, thus increasing the likelihood of their developing PTSD. So what this suggests to us is that the assessment and monitoring of the full spectrum of post-traumatic stress symptoms is quite useful, may have potential prognostic utility, and that interventions to reduce these symptoms may help mitigate risk of developing the full syndrome called PTSD.
Thank you, Doctor. Cherissa, you are known as America's Combat Nurse. I love that title. If you could explain it to us. I know you provided medical care for soldiers with injuries in Iraq and Afghanistan. And first of all, thank you for your service. Would you mind if we ask you how that experience impacted your life and how PTSD impacted you directly?
Absolutely. My first deployment was in 2005 to Iraq, and then I had a follow-up deployment back to Iraq in 2006. And then I went to Afghanistan in 2011. And all during this time from 2005 until 2012, I had totally compartmentalized my PTSD. I had been treating soldiers at Walter Reed and other facilities with PTSD, so I knew what it looked like. And so when it was time for me to discover that I also was suffering with the challenges of PTSD, I realized that I was a good compartmentalizer. And that's what the therapist has said to me. And so for me, it was important that I realize what my triggers were and determine what is a good treatment option for me. For me, it's all about the triggers. So for some people, it may be, I know what to do. I know how to sleep. I know how to combat my anxiety and depression, but me, it's about those triggers. The things that I saw in Iraq and Afghanistan were horrific. And as a result, I came back with PTSD, and I'll never forget those things. But I was on a mission when I came back to make sure I changed the stigma of PTSD. And as a result, I coined the slogan, I'm Cherissa Jackson, America's Combat Nurse. Because I saw what I saw, I continue to advocate for veterans.
Montel, you're also a veteran, and thank you for your service as well. You have been on the front lines. Could you talk a little bit about your experience, how you overcame, and why it's so important to focus on the mental health of our veterans? I know you're extremely passionate about that.
Well, I think one of the things we have to start with, and right from the beginning, and the fact, and I think you said this off camera before we got started, is that unfortunately how quickly we forget. Right now, lots of people continue to spit out that lip service statement of thank you for your service, not meaning you, but others say so, and it's just lip service. It's just like the saying that people say sometimes in the morning, how you doing? And they really don't care about the answer. Thank you for your service was fine and dandy when I think we were in the middle of combat woes and people were so thankful that their children didn't have to be the ones that were being sent overseas. Right now, we need more than lip service. We need to understand that we have soldiers, veterans, who protected and defended this democracy against all enemies they could, 100%, in protection of us. And I don't want this to be something that we quickly forget, especially knowing right now what's about to happen in this country. We can take a look at the example that our veterans and our treatments to our veterans have put forth, the treatments for our veterans have come about, to think about what we're going to start doing for the next pandemic. And what I mean by that is that we're sitting here right now where we have probably some estimates, depending on which science, which doctor, which poll you listen to. But we've just been through one of the scariest times in American history with this COVID pandemic. There are people who have spent time in hospitals who have recovered, and though they've recovered, and some of them think that it's over, we think, and we're starting to see that somewhere around 30% of those who were hospitalized for COVID are suffering from PTSD from that experience itself, along with our first responders, doctors, nurses, and other people who have been helping. So We need to learn right now how we better serve those veterans. And, the numbers have changed from 2018. We were, I think, it shifted down a little bit to somewhere between 17 and 20 veterans a day take their lives. But we don't know what's going to happen after this pandemic and scourge of isolation goes away and we start to get back to what we think is normal. Normal in America is going to be a society where about 30% of its population is walking sufferers of some form of PTSD. So I'm so excited about talking about what we can do for the least of us, our veterans, and translate that into what we can do for all of us as society.
And there's no doubt we need to do better. And that's why we're having this town hall, because I agree with you, Montel, completely. And when I say thank you for your service, it comes from the bottom of my heart. But we were talking about it before the town hall started, and it's true. People tend to forget very quickly, as Cherissa was agreeing with us a few minutes before we got started as well. By the way, I just want to remind our viewers that this virtual town hall is live. It's coming to you live. So if you have a question for our expert, we'd love to hear from you. All you have to do is send your questions right there at the bottom of the screen there, questions@allhealthtv.com, or you can also just post the comment section on Facebook or YouTube right there to your right, and we'll get them on the air as quickly as possible. Dr. Pietrzak, I wanted to turn to you now. One might imagine, and Montel talked about the pandemic, veterans feeling additionally stressed during COVID-19, but the new research says otherwise. And I'm fascinated by this. So what is the hidden side effect of COVID for veterans? Can you explain it?
Sure. So the research suggests that we're seeing both. So my colleagues and I are conducting a study called the National Health and Resilience in Veterans Study, in which we're following a nationally representative sample of more than 4,000 U.S. veterans. We first surveyed the cohort prior to the first documented COVID cases in the United States, and then resurveyed them 1 year later, about 9 months into the pandemic. And this is actually a rarity in trauma research, where we just so happen to have a pre-pandemic, a baseline cohort. And of course, happen to be nationally representative. And consistent with the research that's out there describing the adverse mental health effects of the pandemic, we found that 13% of U.S. veterans reported pandemic-related PTSD symptoms. And these would include things like repeated, unwanted, disturbing thoughts about the pandemic, and 8% said they had contemplated suicide during the pandemic. We also saw an increase in the prevalence of generalized anxiety disorder symptoms, from 8.2% to 13.5%. And this was in particular in middle-aged veterans, where we saw higher rates of COVID infection. They were also more likely to know somebody who died of COVID-related complications, and also reported more financial stressors. And we also saw these subsets of the veteran population that had increased risk for increasing psychological distress and suicidal thinking. And these included veterans with pre-existing psychiatric disorders, greater loneliness, and greater pandemic-related financial and social restriction stress. However, we also found that 43% of US veterans, this is more than 3 times the number of those with pandemic-related PTSD symptoms and 5 times the number of those who contemplated suicide, reported that they experienced positive psychological changes as a result of the pandemic. They said that the pandemic led to their having a greater appreciation and gratitude for life, increased connection with and compassion towards others, and an increased sense of personal strength. The prevalence of these positive psychological benefits, or post-traumatic growth as it's known in the field, was even higher among veterans who screened positive for pandemic-related PTSD symptoms, with 72% reporting such benefits. While this finding may seem counterintuitive, the association between PTSD symptoms and PTG is best characterized as an inverted U-shaped association, with the highest levels of PTG occurring at moderate levels of PTSD symptoms. When there's too few symptoms, there's really nothing to grow from. An individual is resilient and quickly bounces back from an experience. But if you have too many symptoms on this side of the inverted U, an individual is too overwhelmed to experience growth. However, once the symptoms are controlled, growth may be possible. This process, we're capturing it in a moment in time, 9 months into the pandemic, often happens naturally, and it may unfold over months to years and even decades. And it's stimulated by deliberate, organized, and reflective processing about a traumatic event, often in the context of support of others. So being sufficiently shaken by an experience and developing PTSD symptoms may actually prompt this entire process to begin the processing of the traumatic experience at a deeper level. There are a number of personality characteristics such as extroversion, openness, conscientiousness, and also having a strong sense of purpose in life, of gratitude, and of social support that may help foster post-traumatic growth. Military training and experience, which encourages perseverance in the face of adversity, as well as developing adaptive coping skills in managing past traumas, may also play a role. I should also note that veterans in the United States are on average 20 years older than non-veterans, and they have considerable life experience in managing and overcoming stressful events. And given that struggling with symptoms spurs this post-traumatic growth process, some researchers have referred to it as turning wounds into wisdom. Now, the scientific study of post-traumatic, I'm sorry?
No, very interesting, doctor. Thank you so much.
Yeah, sure. I had a couple more thoughts, but
I do want to, oh no, doctor, please finish your thought.
Sure. I was just going to say that the scientific study of this process is relatively new, but the concept is not. There's a number of ancient religious, spiritual traditions, philosophers, and scholars who have long described the potentially transformative power of suffering. It's important to keep in mind, though, as Montel noted, that a person's capacity for post-traumatic growth will depend on their personal experiences, circumstances, and resources, and that this experience of growth is not a universal or given by any means. One of my favorite quotes that captures the essence of post-traumatic growth is from the late psychiatrist and Holocaust survivor Viktor Frankl, who said, "When we are no longer able to change a situation, we are challenged to change ourselves." Our results further revealed that greater post-traumatic growth, particularly greater pandemic-related increases in the appreciation of life and improvements in social relationships, was associated with a 40% lower likelihood of contemplating suicide during the pandemic. So this finding suggests that interventions to promote post-traumatic growth may potentially be helpful in mitigating suicide risk, though we need more research. And we should also keep in mind that suicide prevention efforts should extend beyond mental health and look at the bigger picture of how the pandemic has affected veterans' functioning more generally, including housing, employment, finances, and relationships, and ensure that their needs are met in all of these domains.
Absolutely. And again, that's why we do these town halls. And doctor, that's a great lead into a story I'd like to share with our viewers, because there's many organizations and institutions working to help our veterans. A South Florida PBS series called Battleground Everglades profiled a very special man who combined his passion to help vets with his love for the environment. Let's take a look real quick.
The state's lieutenant governor assisted with this capture.
Snakes have a very unique pattern.
But he couldn't have done it without Tom Rahill and his group of military vets and first responders, called the Swamp Apes.
I started the Swamp Apes organization to help veterans deal with various challenges they may have returning from their service to the country. We welcome all veterans, and many of our veterans that join us are just here strictly for the adventure. But the common bond with the veterans is that they want to help the wilderness.
On this buggy South Florida summer evening, Tom and his team are on the hunt for pythons, searching burrows and armadillo nests, looking for any evidence of the big snakes. He's joined by Rams, a combat vet who served 2 tours of duty in Iraq. Rams's largest catch to date was a feisty 7-footer. He says his time with the Swamp Apes has helped him cope better with the emotional wounds of war.
When you first get out of the military, it's a little hard to communicate as you did before you went in. So when Tom and the others take us out there and kind of give you an extra push to communicate with people as you used to before, it helps a lot.
So knowing what you do, would you encourage other veterans to join the Swamp Apes?
Absolutely. I've brought out numerous other veterans before. For the most part, a lot of them do enjoy being out here, helping out. You have to be part of a team to come out here and hunt pythons, because we're looking after each other. We're looking out for everybody's back when you're out here, and it gives you a sense of purpose because of what we're doing as well.
Okay, what do we got here, Tom?
Hey, man, I think we got a potential python nest.
Tom and Rams are joined by Omar Gomez. Omar, a former paramedic diagnosed with PTSD, says he's found focus and meaning here in the Everglades.
And the program helped me a lot, to kind of get back into it and function back out in society and at home and everywhere else. and I just thump it, and I can hear the hollowness, and I can follow.
Omar's biggest catch was a pregnant 13-and-a-half-footer carrying 67 eggs inside her.
That's one snake with minus, 67 possible other snakes. I mean, that's just, you get up and you think to yourself, I'm going to change the Everglades today by removing one python. And you can literally say that with that big 13-footer, pulled out, that's a big change.
Omar's passion for the Everglades elicits different reactions from family and friends.
Some think you're crazy. Some think it's the best thing that's ever been, put out there for me. I can say as far as my wife is concerned, she's a big supporter of this. She's seen all the changes in me. Same thing as my folks, back at home. They've seen a lot of changes, positive changes. And if anything is good for someone, I think you could say to yourself, this is probably something that's going to be effective. This is something that maybe someone else can be using in their family to help them out, through some hard times.
The hunters get paid for the snakes, $8.10 an hour, plus $50 for the first 4 feet, and $25 per foot after that. That can add up. But Tom says the swamp apes don't do it for the money.
They have this sense of duty to country. They have this altruistic, philanthropic attitude. They're giving of their lives. They did that in their military service, and now they have a chance again to do that and to be celebrated for giving. And in this case, they're helping the environment.
Cherissa and Montel, I actually want to bring in your personal experiences because people use their own ways to deal with these situations. So, Cherissa, let me start with you. You talked about your personal experience with PTSD. What did you do? How would you, go on with life day in and day out?
I have a strong sense of faith. I was born Christian, so I would meditate, and I had to figure out what worked for me because, again, I used to take care of the soldiers, and I knew the common medications that we would give the soldiers, and even when I went to therapy, those medications were offered to me. But I didn't want to not be myself with those medications, so I had to be on this journey of finding what worked for me. So I knew. Going back to my spirituality, it always would bring me out of those dark times of divorce, dark times of being deployed multiple times and being a single mom and going through financial ruins. So I went back to what I knew, which is meditating, and I would meditate daily. And not only that, I'm a big athlete. So I started training for a half marathon. And when I would sweat, it felt like I was sweating those memories, sweating those tears, all my anxiety and fears away. But in essence, it was a way for me to purge and be able to just cry because I didn't have someone that I could talk to. I couldn't talk to my family. I couldn't talk to my friends. I couldn't go to my commanding officer. So I was in just isolation, trying to deal and cope with my own problems. So my spirituality and meditating, working out, and then finally just going through therapy and accepting that I needed a little additional help with some of my challenges and being brave enough to do that. And for me, that's worked. And it continued to work for me. And then I kind of journaled all of that in a book that I wrote called At Peace, Not in Pieces, to allow other folks to know that just because I'm a veteran doesn't mean I can't relate to anyone else dealing with trauma. So it's a way to just journal what you're going through, figure out a component that works, and just continue to execute and see, the change in your life and give you hope and inspiration, which is what I'm here to do to any veteran that's suffering, is to encourage, motivate, and inspire.
Thank you, Cherissa. Montel?
Cherissa just nailed it. I mean, honestly, the first step is admitting that you have a problem and understanding that there is help out there. And though the organizations that are, chartered with helping may not have all of the answers, there are other organizations that exist in this country that do have some of the answers. And I found that for me, though I'm not in Cherissa's generation, my stresses really focused harder once I was out of the service and then literally dealing with life, dealing with the diagnosis of a chronic deadly illness, dealing with, I went back to Afghanistan to visit troops, and during that period of time that I was there, some of the rockets red glare on the other side of the fence literally reminded me of things that brought back a few moments of PTSD for me that I really understood that I needed to ask for help for. And when I did ask for help, I got it. And I reached out and utilized the services that are out there and available. It requires a little digging, a little effort on my part, but I think that effort on my part is an effort that anybody who is suffering can go through if they decide that, yes, I have a problem, and yes, I need help, and then reach out to get it.
Thank you, Montel. Dr. Norman, I want to talk about some warning signs that people should look out for. And if they see them, how do they handle it? What should they do?
Yeah, everyone has transient times where they don't, where they struggle, where they don't feel their best, and that's just life. But if that's kind of continuous, where someone is down, anxious, can't get the trauma out of their minds, where it's really impacting their ability to live the life they want to live. And what we see a lot in treatment is when people come to us, it's because they just got a DUI, or because their spouse is saying, I can't do this anymore, I'm out if you don't get help. Or they're stuck in school, in their career, they can't progress, they're having problems. So we call those functional problems. And generally, those are the things that bring people into treatment. It's not that they're like, I have these symptoms, but they're like, my life is messed up. This is not how I want to live, and I feel awful. And so any of those can be warning signs. And those things tend to be a little bit more chronic. And what we know with PTSD is people can recover after a while, but the chances of recovering and recovering more quickly are so much better with treatment. So it can be hard. It can be hard to say, okay, I need help, just like Montel said, but that really can't be the turning point.
And I was reading here some things that they suggest not to do, not to pressure your loved one into talking. Let your loved one take the lead, or your friend take the lead, rather than telling them what to do. Be patient. How important is that, to be patient? And I'm going to probably ask Montel, Cherissa, and even Dr. Pietrzak to chime in. So Dr. Pietrzak, let me start with you.
Around patients, I think absolutely people need the space to see how they manage their post-traumatic stress on their own, using their own resources. And in some cases, the tendency may be to be more closed up and more hesitant, but I think it's important for loved ones to provide a context that is supportive, and that sends the message that if the individual wants to talk, that supportive other is there. So absolutely, I agree that the patience and the space are absolutely critical.
Cherissa?
Yeah, I think for me, I had to exercise patience for myself, right? Because I wanted to come back whole and be that Cherissa I was prior to my 2005 deployment. And so I had to give myself permission to be patient through the process of learning who I am again. And not only that, I had to coach my family into being patient with me as well, because they wanted me to be that old Cherissa, and they didn't quite understand PTSD nor how to deal with the new Cherissa. So all of us had to deal with the patience and having to understand and figure out, what's our new path and what's the new relationship is going to look like. And oftentimes I have family members who have, veteran husbands and wives who are dealing with PTSD, and they don't have patience. And I'm always saying to them, you have to have patience so that you all can come together and unite and be there to support the veteran. So I really believe patience is key. You will not see a veteran come back like they was before. And in order to have them live their best life, family members, spouses, children, work, everyone has to be patient along that way.
And Montel, I'd like your thoughts. And I'd also like to follow up with a question of what support have you seen that you believe is helpful?
Well, it's very interesting, Olga. Right now, I think what's going on with our veterans, and we're finally starting to reach a point where we can understand at least, the varied verticals in which they need to get help. And I think Cherissa nailed it when she says we need to have patience. But we as a society are going to have to learn that same patience for all of us in the society. Mm-hmm. Again, we're coming out of one pandemic and getting ready to walk right into another one, and that a nation's not facing the truth. That, coming out of COVID, we think that, we took our mask off this week, so everything's going to be fine. No, it's not going to be fine. And guess what? It's okay that it's not fine as long as we are working towards solution. But right now, while we live in a society that is so divided on every single level, so many of us have forgotten to reach out to that friend that we know might be suffering and say, hey, how you doing today? And then really stop to listen to the answer. And when they say, oh, no, everything's fine. No, come on, don't just give me the pat answer. Tell me, how you doing? What have you been doing lately? You're still, oh, I'm staying at home, haven't gone out. Well, let's talk and dig into that. Why haven't you gone out? Why don't we get together? Now that we can get together, now that the masks are off, why don't we get together and go grab a cup of coffee, just to chat, and then really, truly ask that question. How are you doing? And expect to listen to the answer. That's part of, I think, one of the biggest issues that faces us as a nation. We are so, self-centered and so unwilling to take the time to share with others who we are, share with others the fact that we aren't perfect. That'll give another person an opportunity to open the door to say, you know what, I'm not perfect either. I can use some help. And, for me, again, I've been working on multiple varied forms of and varied protocols over the course of the last 10 years. Everything from protocols that have been helping and now have been FDA approved for traumatic brain injury to protocols that have been approved by the highest authorities for PTSD. And those are things that I'm really out here trying my best to make sure that when I speak to veterans, I speak to them on almost a daily basis, I make sure that they understand that help is there. There is help out here. Now let's figure out the fact that you need to step up to the plate and say, you know what, maybe you're right. Maybe I can get some.
Olga, if I could add a little bit more about caregivers.
Of course, Dr. Norman.
Yeah, I just want to agree with what everyone's saying and add that, the people who love people with PTSD, that could be incredibly stressful too. And sometimes we're talking about people in their early 20s whose spouse left for Iraq or Afghanistan, came back and is very shut off, communicating very differently, much more angry, much more distressed. And they don't really have the skills to know what to do. They try to draw the person out and they get stuck. And we know from research, from meeting with these family members, they're very, very stressed too. So for anyone who's listening who's in that position, I encourage you to get support and help as well, whether you're a spouse, a parent, just a loved one. And if you're wondering, how do I help? I can see that this person needs help and they're not willing to go. The VA actually has a service called Coaching into Care. You can Google it and find it. And you call and you talk to someone who kind of helps support you and helps open that conversation with your loved one about getting help.
Thank you, Dr. Norman. And it's true what you say, and loved ones come back sometimes seriously injured. And even that in itself takes a toll on the whole family, the caregivers. We forget about the caregivers who are also taking everything in their lives to make their loved ones better. I do want to introduce, if you will flatter me, Dr. Jobyna Whiting. She is the director of degenerative spine surgery at Baptist Health's Miami Neuroscience Institute. During her medical training there, she worked with patients suffering from traumatic brain injuries and PTSD at the VA hospital in Gainesville, Florida. We asked her how these two are connected. Listen.
The details of how those two things are connected exactly are still being worked out right now. However, it's clear that having traumatic brain injury puts you at risk of having post-traumatic stress disorder. And so there is a link between the two. You're more likely to get PTSD if a traumatic brain injury is part of your trauma and part of your injury. And there's also some evidence that would suggest it might be a more severe outcome or more severe situation with your PTSD if you have also had traumatic brain injury. In addition, there are overlapping symptoms between the two in terms of things like sleep disturbance, irritability, and fatigue, as well as other symptoms.
Dr. Pietrzak, your thoughts on this?
Yeah, so we've done a little bit of work over the years on this, and there was a classic paper a number of years ago published in the New England Journal of Medicine showing that PTSD symptoms in particular fully mediated associations between concussive symptoms and functional impairments. And we also replicated that finding. what that suggests to us, and this is true also, there's a broader literature as well in motor vehicle accident survivors suggesting that what's known as post-concussive syndrome, which is really this hodgepodge of symptoms that are psychiatric, neurologic, and so on, can be quite disabling and lead to the functional impairments that we see in individuals who've experienced a mild traumatic brain injury. So certainly it's one of those things where I think from a clinical perspective, we need to be mindful of really the full spectrum of symptomatology that could arise in people who have suffered such injuries.
Cherissa, I know PTSD education is very important to you, especially when it comes to suicide prevention. You run the HEAL program at AMVETS. Talk about this program and how it helps. And also, I'm just curious, what advice do you have for veterans who maybe are just afraid to ask for help?
Yeah, I'll start with that one first, because that one is near and dear to my heart, because no one gave me permission to just talk about my symptoms and to talk about PTSD. So for any of the viewers that are watching this broadcast, just know that it's okay to not be okay. That's the most important thing. And if no one's ever given you permission to not be okay, I'm giving you permission tonight. It is okay not to be okay, because once you admit that, then you're willing to open up and say, I need help. And you will therefore find those resources that you need in order to get the help that you rightfully deserve, in order to live your best life. So it's okay to not be okay. I give you permission today to know that you don't have to be strong. PTSD is not a sign of weakness. And so for me, it's important that working at AMVETS as their chief medical executive, they brought me on to run their HEAL program. HEAL stands for Healthcare Evaluation, Advocacy, and Legislation. So anywhere in those pillars, I'm able to assist a veteran. And let me tell you, Olga, when these veterans come to us, to the HEAL program, they're desperate. They have looked for every imaginable resource out there to help them. And they come to AMVETS. So I have a charge on my life to really find these resources for them, because I can hear the hopelessness in their voices. And so the HEAL program allows us to find those resources for them. And that could be helping them find a job, help them with finances, help them with getting mental health resources at the VA or any other resources at the VA. But more importantly, one of the pillars is all about helping to decrease veteran suicide. And AMVETS was the only organization that's created an online suicide prevention training, because we wanted to make sure we tool everybody with a resource to help them be able to talk about suicide, to just say the word and be okay embracing what suicide is, so they're prepared when a family member or a friend is thinking about suicide. So I'm very proud of that program, and anyone that's watching can go to our HEAL page, AMVETSHealprogram.com, to sign up for that training. It's for everybody. I have scenarios for veterans, for caregivers, for police officers, first responders. And so that's one of the key components of the program, is to help save the lives of veterans.
That's fantastic, Cherissa. And Montel, there's something she said that I absolutely love. I wrote it down. It's okay to not be okay. I think I'm going to have that soundbite on my desk every single day of my life. You talked about going back to Afghanistan and meeting with veterans there. Did it help them to have you there to, maybe you didn't say it's okay to not be okay, but to know that you went through it and you were there to help them?
I think, they just wanted to have a sense of a touch of home, and to have somebody from home come back there to really let them know that they cared about them and they recognized what they were going through and recognized the fact that they were doing that for us was one of the most important things that I think I was able to share in my time that I was there. I was there, several years ago when General Petraeus was there, and as was the on-scene commander, and I visited all over the entire country. I went to Kandahar, I went to several different places, and made sure I stopped and just visited sat down and ate, broke bread with some of the soldiers in theater to let them know that we at home remember them. So, but it brings me to today where, Olga, we work on a show together, and I work on a show out of the same production company, which is called Military Makeover, where, we spend time with deserving veteran families and we make their homes over from the ground up, not to give them a handout, but to give them a hand up. And to also say, thank you for your service, and not just say it, but to do something about it. And when I visit with those veterans, I recognize how some of them are so troubled because they feel like, though they're back home and now Rocket's red glare is done for us, it's never done for them. They're still living it every night. Sometimes when they go to sleep, they're still living it every morning when they wake up. Their children are living it through them. And some of them are starting to feel like, maybe we forgot it. And so I don't have to go all the way to Afghanistan to tell a troop that I care about them and I thank them. I try to do it right here. And I think everybody else that's watching this tonight can understand that they can do the same thing. There's a veteran who lives on your block who, you might be able to go down the street and when you overcook one night, take a meal down to them. Maybe, next week on a Friday night when, that it's a young couple, well, maybe go down and say, hey, you know what, I'll watch your kids for you tonight if you don't mind. I want you guys to go out and have a date night. For us to do something for them means the world to them because it means like what they did for us isn't going ignored.
Absolutely. Thank you so much, Montel. Dr. Norman, I want to talk about treatments if we can for just a little bit. What can be done medically to treat PTSD today? What is protocol and are there new treatments in the horizon?
There are. I'm so glad you asked that because there really are great treatments and more treatments on the horizon. But we do have, we have therapies and medications that have been studied for many years. And one of the interesting things with PTSD is it appears the psychotherapies actually are the most effective treatments. And this just doesn't mean just walking into anyone's office and talking about anything. These are specific therapy protocols that are manualized, that have been studied. They're generally about 8 to 12 sessions. So that means 8 to 12 weeks, or sometimes they're even done daily or over 8 to 10 days. Now we see they're still effective. And the specific protocols that have the most evidence behind them are prolonged exposure therapy, cognitive processing therapy, and eye movement desensitization and reprocessing, or EMDR is how a lot of people know it. What these have in common is that they're trauma-focused therapies, meaning that people process the pain of their trauma, the memories. A lot of times when someone goes through such an emotional and difficult event, the instinct is to push it away, just keep going, not deal with it. But we know that that pain is still in there, whether it's fear or loss or grief or guilt. And so these therapies help the person kind of experience that and move past it. The memory is there. The memory is painful, horrific, life-changing, but it no longer causes PTSD. The memory is a memory and people can go on with their lives. There are, for those who feel like therapy isn't right for them, there are medications that help with the symptoms, specifically classes called SSRIs and SNRIs, some of the antidepressants. And there's some therapies that work reasonably well where people don't have to talk about the trauma or process it if that's very, very aversive to them. There are a lot of things on the horizon that are exciting. People are often asking us about ketamine and medications like cannabis, or or agents, I should say, like cannabis and psilocybin and others. And we really just don't know yet. What I suggest is the same thing that I suggest with my own family. If one of my family members is sick, I say, let's figure out what it is and let's get you the best treatment that we know works. And if those don't work for you, then we can try some of the more experimental stuff. But let's start with the things that the evidence says are most likely to get you better. And right now with PTSD, that's those psychotherapies I talked about: prolonged exposure, cognitive processing therapy, EMDR, and some of those others as well.
Thank you, Doctor, so much. I just want to remind our viewers that this is a live town hall. So if you have any questions, and we're going to get to a few right now, all you have to do is send it to us and we can show them on your screen right there. Send your question to questions@allhelptv.com, or you can put it in the comments section of your Facebook and YouTube, and we will definitely get it on the air. I want to get to a viewer question that I just received. And where did I put it? Right here. So I'm going to read it, and I'm going to have Montel take this one. What can be done to better help our veterans, especially the underserved populations like homeless vets? We've been talking a little bit about it, but I'd like you to chime in on our viewer question.
Well, again, one of the things we have to do as a nation is to stop for a second and quit playing lip service and step up to the plate and do what we're supposed to do. And that is to try to protect and serve those who have protected and served us. It is an abomination that one of the wealthiest nations in the world has a population as large as our homeless veteran population is here in America today. It's an abomination. I think it's ridiculous. And as we're looking at, this particular administration's, whole program about, revitalizing infrastructure in America, infrastructure for our veterans should be something that should be the immediate concern. And immediate concern because for us to continue to fill our ranks with a true voluntary service, we're going to have to start demonstrating clearly that we can handle what we've already done. So, I think there are a lot of programs that are out there, a lot of cities that are out there that are now trying to really hit our homeless veteran population head on. I know that, the fact that we have, the large population of female homeless veterans that we have today in our society is another one of those things should be that embarrasses all of us as American citizens. So, the more and more we can step up to the plate and provide those services to them and come up with really good, tangible ways to get them off the street, not next year, not 5 years from now, but today. That's what we should be doing.
Thank you, Montel. I have another viewer question. Dr. Pietrzak, is there still a stigma attached to PTSD? Can you talk about that?
Absolutely. I mean, there's stereotypes that depict people with PTSD as being dangerous, unpredictable, incompetent, or that blame them for their illness are definitely out there. There was a recent review that was completed on mental health stigma, which concluded that there is no country, society, or culture where people with mental illness have the same societal value as people without mental illness. And of course, we know that stigma can lead to discrimination or exclusion, which can prevent individuals from seeking help or adversely affect their standing in the military, employment, educational opportunities. And that internalization of stigma in turn can lead to lower self-esteem, reduce confidence in one's ability to recover, and potentially exacerbate PTSD symptoms. And this is particularly stigmatized in military personnel and veterans, given the stoic warrior ethos. And my group has done some research on perceptions of stigma and different barriers to care, and found that veterans who endorse higher perceptions of stigma, in particular feeling weak or ashamed for seeking mental health treatment, were associated with greater severity of PTSD symptoms, as well as a lower likelihood of engaging in formal mental health treatment. We also found, importantly, and I know that we've been talking a little bit about this, is that there's quite a bit of negative beliefs about mental health treatment, and quite a bit of lack of trust of mental health providers, and doubting the effectiveness of mental health treatment. And we have research to suggest that this is associated also, in addition to stigma, with a lower likelihood of engaging in mental health treatment. In our most recent study, this was a collaboration with Dr. Norman, we found that only 36% of suicidal veterans in the United States are engaged in any mental health treatment. And that two of the key factors that were preventing them from seeking care was mistrust of mental health providers and fear of treatment harming their reputation. And so what I think this work collectively underscores is the importance of continued efforts to target not only stigma, but also to improve mental health literacy about evidence-based treatments, that they work, but then also self-help strategies. And I think opening up to veterans to give them really the range of options that we have available. I mean, there's an incredible range of therapeutic options that are available.
Cherissa, can I have your thoughts on the stigma? Because I saw you nodding your head, and I'd like you to chime in if possible.
Absolutely. One of the key points that I had to deal with was the stigma before I even came out to my friends, my family. And I knew that a lot of my nurses were dealing with the stigma, and they didn't seek help when they probably should have sought help sooner. It's because of that stigma. And that stigma is very strong because no one is educating the community on what PTSD really is. So therefore, people are attaching PTSD to someone that's crazy, someone that's weak. But in essence, by seeking help, you're really showing your strength. You're showing that you're strong enough to say, I need help. But the community as a whole has to have that same perception and allow us to be able to be okay saying that we have mental health challenges so that we can get the help that we need. And I would say a good example of this stigma that's out here in the community, I had a presentation at West Point, and I was speaking on a panel there, and one of the West Point graduates' father came to me and said, you don't look like someone who has PTSD. And I was flabbergasted by that. I was like, what does that mean? Am I supposed to be a poster child for PTSD, looking crazy and disheveled? And I had to educate him on the spot because I didn't want him leaving that panel thinking PTSD means you have to look a certain kind of way. And there's many phases of PTSD, and the community as a whole has to embrace that so that that stigma can be decreased and veterans can feel okay expressing that they need help because they're suffering with PTSD.
Thank you, Cherissa. I want to go back to Dr. Whiting.
Olga,
Yes, sir. Go ahead, Montel.
Sorry, I want to just interject. Sure. What we see in our veteran community, think about this. When our veterans are being looked at as being weak, can you imagine what our general society is feeling right now for those who are suffering from the traumatic scars of their hospitalization over the course of the last year for 2 to 3 months where they couldn't breathe? Are they going to step up to the plate and now say to another family member after they survived COVID that, well, you know, I think I'm suffering from PTSD, when they think, well, it wasn't a war, then I shouldn't even say anything about it? We've really got to end this stigma. We've got to end this idea that mental illness is weakness, or the fact that you need help makes you weak. It doesn't. It makes you a human being. And the quicker we come to that resolution and we learn from what we're learning from our veteran community, the faster we as a society are going to heal.
Amen to that. Thank you, Montel. I'd like to go back to Dr. Whiting, if that's okay. By the way, her grandfather, her great uncle, and husband all served in the military, and she has a unique perspective, obviously, with all her family members and her being a physician. Listen to this real quick.
I have no problem whatsoever understanding and respecting what veterans have done for us. And I was raised to understand that. And I was also raised to realize that this is a really important and integral part of them afterwards. They don't just come back and forget about it. And so I feel grateful that my career has allowed me to interact with and help veterans at certain aspects of my career. And I am happy to do that whenever I can. For me, working with vets is a pleasure. I think it's a real honor to be able to do that. And anybody who gets to do that as a physician is really in a lucky place.
You know, I love what she said, and I wrote a couple things down. Respecting what veterans have done for us, something we've been talking about throughout this hour. The impact of serving stays with a veteran. We have about 5 minutes left, and I'd like you all to give me some final thoughts. Are you hopeful? Dr. Norman, I'm going to start with you.
I'm extremely hopeful because we do have great treatments. We have people like this panel who are so passionate in getting the right message out and have the platform to do it, which is so important and so exciting. You know, the part where I think we have the biggest gap is still people knowing that there's hope, that there's treatment out there, that PTSD isn't a life sentence. So anything we can do to further spread that message and get people to good treatment is just where we need to be focused.
Thank you, Dr. Norman. Cherissa?
Absolutely. I think there's hope out here for anyone dealing with mental health challenges, particularly PTSD. But the one thing that we have to do as a community, as a country, is just allow us to be human. Allow us to have challenges, and you don't stigmatize us with the challenges that we have. And to also present options for us, options that work, that don't put everybody in the same box. And by doing that, it does give us hope, because you're not allowing me to have the same treatment that you gave someone else, that you're individualizing me, which allows me to feel like, okay, this is the plan that can work for me. And by doing that, it fosters hope. So yes, I have hope for this world. I have hope for veterans. And conversations like this will allow veterans to know that they're being heard, that people are concerned about them, and that there is hope out there because we're talking about it. When you don't talk about it is when people are hopeless, and we don't want that.
Thank you, Cherissa. Dr. Pietrzak.
Yeah, I'm absolutely hopeful. And, you know, if I could have a t-shirt statement, it would say that we should focus on building what's strong in addition to fixing what's wrong. I think that we've been talking about PTSD specifically, but I'm really hopeful in our ability to potentially broaden our focus from pathology and disorder and mental health treatment as being instrumental really to bolstering overall health, wellness, resilience, personal growth, themes that resonate better with veterans because they emphasize strengths instead of weaknesses. There is no health without mental health. And if we focus solely on mitigation of PTSD symptoms, that's too limited. We want to strive to promote wellness and flourishing in veterans, increasing their sense of accomplishment, engagement with the community, and cultivating a strong sense of meaning and purpose in their lives and the lives of other trauma survivors.
Thank you, Doctor. And Montel?
Well, I think one of the things we have to, as a society, remember is that since back when September of 2001, about 2.7 million veterans served in both Iraq and Afghanistan. And about 10 to 20% of them came back with some form of TBI, whether it be mild to moderate, severe, or otherwise. But they came back and they bear the scars of that service to protect and defend our democracy. We owe it to them. We owe it to all of them who stepped up to the plate and took advantage of the opportunity to raise their hand in the air and say, I do solemnly swear or affirm that I will support and defend the Constitution of the United States against all enemies, foreign and domestic. We owe it to them because they kept our children from having to do the same. And so right now, while they are suffering and some of them are in extremis and they are in the greatest need that they have been in quite a long time, since maybe we remember since Vietnam, it's time for us now to stop the lip service, step up to the plate, get done what needs to be done. I hope that the VA and all of the support organizations out there recognize that it's time for us to open the doors and think outside of the box. There are protocols that we have considered experimental that in some places in the world have already proven to be evidentiary medicine. But here in the United States, we stopped them from being able to be used here because, in some cases, some places in this country, there's a cottage industry built around suffering. Well, it's time for us to open the doors and acknowledge the fact that, if this isn't working for this person, and we've been through 6 or 7 different protocols, let's try the 8th and the 9th. And don't do it hesitantly, do it vigorously so that we can start to support those who did the most for us.
Absolutely. I want to thank all of you for your time, all the information and everything you do. Montel, thank you. It's been a pleasure. Dr. Robert Pietrzak, Dr. Sonya Norman, Cherissa Jackson, thank you so much, and Dr. Jobyna Whiting for her words about her family as well. I also want to, before we wrap, share some resources that if you have a pen handy or a pencil, please write them down. It's for you if you need help. Like Cherissa said, it's okay not to be okay. So a few of them here is for information about PTSD and PTSD treatment, visit ptsd.va.gov. If you're in a crisis, contact the Veterans Crisis Line, veteranscrisisline.net, or you can call 1-800-273-8255, press the number 1, or send a text to 838-255. The HEAL program that Cherissa was talking about, give them a call, 833-VET-HEAL, 833-838-4325, or go to the website, AMVETSHEALprogram.org. Again, to my panel, thank you so much for joining me. I do appreciate it more than you know, and I do appreciate everyone's services. It comes from the bottom of my heart. I'm Olga Villaverde. We thank you so much for your time. Let's do the change, like Montel said, and let's help these veterans every single day. Thank you for watching. Take care.
This program is made possible by Lois Pope. We salute her generous philanthropy and unwavering support of our veterans.